I'm Dr. Julie Witkowski. I'm a physical medicine and rehabilitation physician, and I'm also subspecialty trained in brain injury rehabilitation medicine. I've been working at Northwestern Medicine Marianjoy Rehabilitation Hospital for just over a year, and I'm the medical director of our brain injury rehabilitation program. As you can imagine, from the subspecialty that I chose to practice in, brain injury rehabilitation medicine, I'm a bit biased, but I tend to think that the brain is the most important organ. I can see the same brain diagnosis in 100 people, and it will present differently every time, and my treatment approach will be different each and every time. So when I see a patient, I really try to approach them as an individual, and then I look at what their brain injury related needs are, and I try to apply my medical knowledge and the personal knowledge I have from getting to know that patient and their family, bring those two things together and provide the best patient care that I can. So one of the most exciting things that I've gotten to do since I started working here at Marianjoy was really build a strong collaboration with our partners, particularly our neuro-oncology colleagues, and that includes neuro-oncologists, neuroradiologists, neurosurgeons, and we've done so because we actually share a huge patient base with our neuro-oncology colleagues. There's a lot of patients who will start out in the acute care setting and have a brain tumor resection or some other kind of neurosurgical procedure, and afterwards can really benefit from coming to a rehab hospital for further care. As part of our collaboration with the neuroscience team, we're able to ensure that our patients who have neuro-oncologic diagnoses are not really missing a beat when it comes to their oncology treatment while they're also undergoing their rehabilitative care. In some cases, we're able to have them continuing to get oral chemotherapy medications, or in special circumstances, getting radiation treatments while they're undergoing their rehabilitation in order to ensure that they don't have a delay in that treatment piece while they're also trying to just get back to their life. Because our goal as rehab doctors is to help them relearn to do the things that they need to do to successfully be managed at home and continue their treatments there. But we want to do both things in concert because that is overall, in the long term, the best outcome for the patient. Having a close working relationship with other physicians of other specialties while we have a patient as part of our rehabilitation care is really beneficial for the patient. It ensures that we're delivering them the best possible consortium of medical care that they can receive because they're able to do the getting back to their life that we like to do as part of our rehab care, but also making sure that their other medical problems are appropriately managed and we're following all the recommendations of their subspecialty providers. That being said, I think it's also just good from an emotional standpoint for the patient because they just feel like they're in such good hands when they know that the physician they're seeing every day while they're on the rehab unit is also talking to some of their other subspecialists on a regular basis and making sure everyone is up to date, on the same page, and really working as a team to deliver them the best care possible. I think that all PM&R physicians should keep in mind a number of things when thinking about collaborating with other physicians in the broader healthcare system. Now, when we see patients, particularly on the inpatient side in the rehab unit, they have usually just undergone a number of medical events that led them to that place, right? So they were in likely an acute care hospital for days or weeks or sometimes even months, and then they come to our rehab unit, and our goal is to help them get back to their life, learn how to do things like get dressed, go to the bathroom, take a shower, get from point A to point B. But there's a lot of medical care that went into getting them to that place. So they often are quite medically complex and have a lot of ongoing issues that need to continue to be monitored and addressed and then planned for follow-up after they leave the rehab unit. So when physiatrists have a really good open communication with the patient's healthcare providers, whether that be their cardiologist, their neurologists, their oncologists, and we're making sure that as questions come up, either from us, the medical team, or from the patient or their family, we're getting those questions addressed and answered while they're with us on our inpatient team, and we're able to better prepare the patient and then get back to their life once they get back home.